Welcome to another episode of Brains Byte Back. I'm your host, Eric Espinosa, and today we're diving deep into the future of neurotechnology with a special guest, Israel Gasperin, founder and CEO of Zentrela, a company leading the charge in using a combination of artificial intelligence and EEG technology to analyze brainwaves, which is still fairly new. He's developed a tool that measures cognitive impairment and effects in ways traditional drug tests can't, making it pretty groundbreaking. It all started in 2018 during the historic legalization of cannabis in Canada, in which Israel discovered a niche for this technology. The government was impressed with the concept, provided funding, and supported his research. So he was able to create cutting-edge tools for effectively measuring cannabis impairment. Today, Zentrela's wearable technology is being used globally to help a variety of industries, including cannabis, energy drinks, and wellness products, allowing companies to conduct faster and more cost-effective product testing. This gives consumers direct insight into the psychoactive and non-psychoactive effects of the products that they're buying. Zentrela is essentially providing companies and consumers with a new kind of label. Not the traditional listing of ingredients, but rather listing the effects of the product. We chat about how the future of brainwave analysis is shaping the way companies research, develop, and inform their customers like never before. It's a game changer, so listen in.
My name is Israel Gasperin. I am an engineering scientist, founder, CEO of Zentrela. Basically, we are a neurotechnology company analyzing brainwaves in a completely different approach than the traditional one, which is using clinicians. In our case, we are using artificial intelligence, and I'm happy to tell you more about it.
Amazing. Israel, thank you so much for joining us on this episode of Brains Byte Back. It's great to have a fellow Canadian on the show. I think this is the first time I've had a Canadian guest, and it's relevant to mention that Canadian connection. Because Zentrela, from what I've discovered, it was kind of developed a few years prior to, the historic legalization in the Great White North, which I think we're coming up to 6 years now, because it was in 2018, exactly. Which feels a lot longer. I don't know why. Why don't you talk to us a little bit about the lead up during that time, 2016, which actually developed, I guess, the concept behind Zentrela.
Absolutely, Eric. In a nutshell, I am originally from Mexico. 10 years ago, I made a plan to come to Canada and do a master's in entrepreneurship to start, playing with this type of wearable EEG technology that reads brainwaves. I have always been fascinated with the brain and how it works. And it was a beautiful time because the emergence of artificial intelligence and machine learning was happening in this space, the application of AI to analyze EEG data for multiple applications. So we were one of the pioneers. The original idea back in 2014 and 16 was to use artificial intelligence to analyze brainwaves and detect how drowsy or fatigued a driver was in order to prevent mistakes or accidents, while driving. So I did my master's in entrepreneurship at McMaster with that project. And after graduation, I just fully dedicated my time to interview truck drivers, transportation companies, insurance companies, and drug testing companies, because I wanted to understand what was the issue with driver fatigue. And all of them were telling me, this is, detecting fatigue, we are not interested. But everyone knows that drivers are tired and leaving actually some evidence doesn't really help the industry, because, drivers are paid by distance driven, et cetera, et cetera. However, if you can detect if a person is cannabis impaired with that wearable device on your head, that would be very interesting for us for two reasons. One, because none of the existing drug tests, which are based on saliva, urine, breath, or blood analysis, do not detect cognitive impairment. They simply detect and quantify the concentration levels of a substance, in this case THC, in those body fluids. But it is proven that you may have residuals or, concentrations of substances like THC without being impaired anymore. So if you can detect some brainwave alterations linked to cannabis impairment, that would be really exciting. Right now, it was 2016. They were telling us right now it's not a problem, and the current drug tests do their job very well because it's illegal to consume this substance. But the moment it becomes legal and the government is in the process of legalizing it, this will become an issue.
And I remember in the news specifically, one of the big stories that we were trying to cover was how are officers going to measure, because there's so many ways that you could ingest cannabis. You could smoke it, you could drink it, you could eat it. How would they determine that? And right now, based on the research that I did, right now their primary way of testing that is the saliva test.
Exactly. They have developed advanced an instant saliva test to detect recent cannabis consumption. So anyways, at that moment, I was like, this is the actual opportunity. So I, closed the project related to driver fatigue detection. That was amazing because we were failing so badly on that one, and there was no market interest for that application. But it gave us all the fundamentals and clarity in order to do again what we did before, but now with the detection of cannabis impairment. So between 2016 and 2018, I fully dedicated with my founding team to develop EEG datasets. In other words, record EEG data or brain activity of cannabis consumers when they were acutely high and when they were not under other kind of states. And by 2018, that we were running out of capital, running out of cash. I was freaking out, and I was like, okay, maybe it's time to go back home. The Ontario Centre of Innovation launched a unique fund in order to support any innovative solution that could help the Ontario government to improve the investigation process of cannabis-impaired driving. And at that time, we already had a prototype. So when we introduced this concept to the government, they were like, this is not with bad words, but I would say them to make it more interesting. But technically, they said, this is fucking crazy. Nothing like this has happened before. There is no, evidence in the scientific literature that proves that the AI can detect cannabis impairment based on EEG analysis. Long story short, an external panel of experts that they contracted to evaluate all the applications, including ours, they told them, hey guys, yes, this sounds fucking crazy, but if you don't fund and support this type of crazy concepts and possibilities, who else is going to do it? There will not be angel investors, putting their money at this very early stage of a startup. So you should do it. They funded us, and between 2008, and then the Ontario Brain Institute also funded us. But between 2018 and 2020, we continue investing those 2 years in continuing developing and stabilizing our AI to do the EEG analysis for cannabis impairment detection. And I guess, where I'll take a break and of this story is that at the end of that 2-year period, we ended up contracting a clinical research organization that independently simulated the whole process. We said, this is the way you administered an EEG or brainwave test. Do it, blind the data, and then the only way Zentrela has to process the data and give you, results, whether you collected the data when a person is impaired or not, and telling you how impaired they were, etc., will be through these AI-based EEG analysis. And as a result of that, we published 2 peer-reviewed papers reaching unprecedented accuracy, sensitivities, specificity, etc. And then at that point, the commercialization phase of the company started, not for safety and law enforcement, because also we understood after having meetings with the Ontario Provincial Police that this technology was not going to be used for safety and law enforcement initially. It's still in the vision, but we understood that they were not going to be the early adopters.
So I understand at this point, obviously you made that shift into the commercial market to keep developing your product, and you're seeing it used elsewhere. What type of industries, I guess outside of those selling cannabis, what type of industries are you looking at to serve with your with your studies and with your product and technology?
Yeah. So basically, Eric, what we found out is that law enforcement were not going to adopt it because it requires more scientific evidence for them. And, it's the government, etc. They are usually not the first in adopting new technologies, right? And we started to think and question what could be that early, entry to market. And what we found out is that there is a tremendous opportunity in the research space when it's about studying non-therapeutic effects of cannabis, and also any other type of wellness product. But what we understood is that there was a reason why all of these cannabis companies have been commercializing their products without being able to describe the type of effects that they create. And the reason of that is because there didn't exist a scientific and objective way of quantifying cannabis psychoactive effects, problem number one, but also there didn't exist a fast and affordable way of conducting this type of human trials. Either you do a clinical trial, which is great for medical and therapeutic projects, or you just do product reviews, which are very unreliable and completely subjective. So the government tells producers, you can make any type of product attribute claim as long as it's provably true. And in order to be provably true, you need to do scientific human trials. And in order to do a scientific human trial, you need to do a clinical trial. So what we found is that there is something very open called observational trials that allows you to start doing this type of research for non-therapeutic purposes. After 3.5 years of going back and forth with Health Canada, I don't want to claim that it's due to us, but I think that we were one of the contributors that created awareness in Health Canada that there is a space of non-therapeutic research that doesn't need the clinical and the medical grade standards in order to do research about psychoactive effects of cannabis, alcohol effects, mood changes, etc. Like, this is not therapeutic, and so they approve it, etc. So getting back to the point, the technology that we built has been used in the last 3.5 years as a new fast, cost-effective, and objective way of measuring the psychoactive and non-psychoactive effects or other type of effects of cannabis products like relaxation or energy, etc. So then licensed producers can use this type of data in order to reinvent and optimize their CPG business or consumer packaged good business. Now they are doing, testing of new formulations very quickly, more reliably and cost effectively. So they decide which of the formulations is the most effective. And then based on this evidence that complies with Health Canada's regulations, they are using it to launch education programs for retailers or consumers in order to better understand what is the efficacy of the products. And technically, that's what we have been doing in the last 3.5 years. And this year, we just entered into we just extended our offering to other wellness solutions that are, also developing products not for therapeutic purposes, but for relaxation and energy, recreational or non-therapeutic purposes. So now we have expanded this to the global wellness market, and it's very exciting to see that we have found an unmet need in this specific niche.
So I know the Canadian Cannabis Act has parameters for Canadian brands to communicate product effects. At the beginning, there wasn't really a way to measure that because there's a lot of players in the market. A lot. Like you walk on a lot of corner stores, you'll see different cannabis stores. But what is the government doing to make sure that these companies are following the regulated rules in terms of how to properly measure the effects and to the degree of how cannabis might affect your motor skills or day-to-day activities?
Yeah, I think that Health Canada has been doing a great job here in Canada compared to other countries because, for example, if you go to a cannabis store here, a legal cannabis store is highly regulated and it's very limited, the information about the effects that you can see there. But tenders need to follow, or retail employees, in other words, they need to follow strict training and guidelines in order to, support consumers to make informed decisions objectively. So I think that they have been doing a great job in that regard. And also, I think that they have also done something very well in terms of leaving the door open to generate product effect data through a scientific research framework that they have created. And that's the exciting part, right? Because they, in order to do this type of human trials, you need to submit your master research protocols to them and they need to approve them. So everything is very well connected and united. Obviously, nothing is perfect, and I think that there is a lot of opportunities to accelerate and speed up this process. I think that also there is a little bit of a stigma, which I think is not fair. Just to disclose, I am not a cannabis consumer. I am not an alcohol consumer, but I see the benefits and the negative sides of both aspects. And I think that right now the tendency leans towards a little bit some negative aspects of cannabis, which today they don't make sense because if the federal government has legalized this substance for recreational use and they are making a lot of money, I think that they should be they should help to accelerate this process. But overall, I think that they have been doing a great job.
I think in Canada, it's just become so part of our culture now that within the next 10 to 15 years, it's just, you walk down the street and you smell it and it's just such a normal thing. But it's interesting to sit here and talk with you today because I've made this joke with my friend in the past where when we walk into a cannabis store, really when you're buying a product, it's based on the effects. And whether or not they're saying sativa or indica, one makes you happy, the other one makes you relax. That's what determines you buying the product. And I've made the joke before about like, is it just a guy sitting in a room testing out all the products to see how he feels? And he's, has a scorecard in front of him. But essentially what you're saying is that you are that guy. You are that company offering that technology to determine what those products, right? The effects of those products are, so Canadians really know what they're buying.
That is exactly right, Eric. We are following these scientific and objective procedures or protocols in order to characterize that type of effects and also understand, what type of effects products create depending on the amount that they are consumed, that the consumption amount, and more importantly, the type of consumer, because it's very well known that there is a lot of human variability or human factors that contrastingly cause different effects. For example, gender, we don't know necessarily if it's gender, but we have been conducting studies with CBD, for example, CBD products, and our, EEG analysis show that women react more to CBD in terms of relaxation effects, whereas men seems to be less sensitive to the same amount that women had. Now, I'm not necessarily saying that is the gender the reason why they react differently, but it may be another human factor related to their gender. But the exciting part here is that, and it's related to where I see Zentrela in the future, it's about, helping, for example, health professionals or even the consumers to know what should be the right product and the right amount to consume in order to accomplish that desired effect or experience. Because, basically that's the long-term vision of the company, to have fully mapped the brain with the EEG technology. So, and under different mental states. So the machine learning learns how to do that type of analysis, so we can objectify, standardize, and systematize brainwave analysis to let many industries do this type of mental state assessments for different purposes. So I think there are several possibilities here to change industries and markets, and we are very excited about it.
How about AI? Like, how early on did you realize that this would be such a fundamental technology in terms of really, being successful in this type of research?
Literally, Eric, in 2016. In 2016, that's why I call myself an engineering scientist. Nowadays, scientist, I don't have a PhD, and I have a huge respect for everyone who has a PhD. But in order to build a solution, I just realized that what you needed is more an engineering and innovative approach to connect the dots. And what I was thinking in 2016 is, okay, I have tried cannabis and I have been drunk as well, and I know that my brain is in a completely different way of working or functioning. That is fact number one. Also, I know that this type of EEG technology is reading brain activity, microvolts generated from different regions of the brain. And that's a fact, and it has been used for more than 100 years by neurologists, neuroscientists, doctors. But it is well known that the brain functionality and this type of data generated from EEG technology is so complex that anybody in the entire world and in the history of humanity has been able to fully understand how to analyze it in a way that we can apply this device and know you are high or you are drunk or you are in pain or you are sad, etc. But all of these researchers have shown evidence that they do a little bit of basic analysis, and there is evidence that this technology is capable of detecting that with very basic human-based analysis. So then, at that point, the emergence of artificial intelligence was happening, and that was the third rationale that I applied. It is proven that AI is capable of doing complex analysis that we humans are not able to make. And so then I was like, what would it happen if we start building banks of brain data under different mental states, so we can detect when you're high or you're not high? At a very basic level, that was the way I envisioned this. And some neuroscientists said that this was stupid, and that just gave me more, strength and motivation to say, well, maybe, but you don't have a way to prove that this is stupid and it doesn't work. I don't have it either, but at least I have a logical rationale of why this may work. And I'm glad, and I can say humbly that I was right, and we published these independent papers showing that it is possible. So now the most exciting part is what else can be detected and quantified with this technology. And, the second version of our AI now can also detect your relaxation state. And now that we can detect your relaxation state, now we can determine if a product is making you feel more relaxed or is reducing your relaxation state, which I believe it will be the future also of classifying cannabis products, not anymore for indica or sativa, but by this brainwave analysis showing if it's waking you up and setting you in that active mental state or is relaxing you more, etc.
Well, because in some cases, people can't communicate that verbally. So something like that would be obviously super useful and proactive in identifying that stuff for people that don't have those capabilities. But you know what? You're a scientist in your own right. You're successful with the studies that you've done in the last few years. And you know, I want to applaud you for being part of the Canadian community in eliminating or reducing the stigma that you're right, that does exist. What can we expect, I guess, a little bit? What's in the works right now in the near future? Are you working on anything in terms of other psychedelics, like in shrooms, or because I know you did mention that you're in the exploring the other areas of the wellness space?
Totally, Eric. So this is something very, I would say, is very disruptive and game changing. The research models that we have created for the recreational cannabis market, which Health Canada calls non-therapeutic research, what we just realized is that it's completely replicable and available to any other CPG business that is developing products for non-therapeutic purposes. In other words, what this means is that we can conduct this type of scientific human trials with any other type of non-therapeutic products like energy drinks, caffeine, relaxation, sleep products, alcohol, nicotine, tobacco, beer, spirits, whatever, including potentially psychedelics, I guess, depending where you are kind of geographically positioned. But that's outside the psychedelics. That's the market that we have now extended our offering. So just to give you an idea, now anyone from the entire world can send us their products before commercializing them. So now we can quickly, scientifically, objectively, in a very cost-effective way, help them to test different formulations, help them to find the best one, and then benchmark their solution versus any other competing products in the market, and then using all of this scientific evidence to launch the product to the market and have solid and scientific and independent and objective evidence of their product's efficacy to differentiate them, because we have proven that this boosts sales significantly. So this is the disruptive part that I was telling you. It is going to optimize the way companies run their CPG business. Now that human trials are becoming fast and cost-effective in order to adopt it as a key step in their business to, launch products very powerfully and successfully. So that's what you will see in the next couple of years, and a big development in that space. On top of the contributions and continue projects in cannabis that we will continue executing in Europe, especially, that is emerging.
That's super exciting. The idea that you're making it more accessible for people that are entrepreneurs that basically want to enter the market and really test what their products are and advertise that to their clients. You're crossing borders, but instead of you crossing the border, they're coming to you, right? Rather than you going to them, which is the idea.
Now, it's another good point, Eric, just to let you know, for example, for cannabis, that is a very regulated substance or product. We have clients in United States. For example, Pat's Labs is one of our clients, and there are many other, leading cannabis CPG companies that reach out to us when they saw our peer-reviewed papers, and they said, "I want to use your technology, but I want to do research with you guys, but I don't have access. Like, I'm not going to send you products. It's federally, it's illegal here, so complicated, the regulations. How can we work together?" And we said, so easy. This technology is portable, is non-invasive, and our protocols are standardized. I can implement this in your lab within 2 days and get your team running this right away. Everything is, ready for it. And since then, we have been also implementing the technology, in CPG labs, so they can do their own R&D if required. So that's our vision at Zentrela, to democratize brainwave analysis in one way or another. We can help you, and we do the research from end to end in Canada, here in Hamilton, in our lab, or we can come to you and implement the technology quickly, and then you are kind of set up for, agile research.
Israel, you have the mind of a forward thinker, a businessman, a scientist. Thanks again for joining us on this episode of Brains Byte Back. It was great to hear your insight. Hope that we can have you back in the future to see how Zentrela develops even more.
Thank you, Eric. I appreciate the time. I really enjoyed the conversation and looking forward to more conversations in the future.
That's a wrap for today's episode. If you've benefited from what you've learned today, feel free to leave us a review on iTunes. You can also find all our past and future episodes on YouTube and Spotify under Brains Byte Back. And if you'd like to connect with us directly, you can always reach out to us by email at info@sociable.co. Remember, your feedback helps us grow. We welcome it. We appreciate you joining us. Until next time.